Prostatic artery embolization, or PAE, is a non-surgical image-guided procedure that is done through the blood vessels to shrink and enlarge prostate in a condition called benign prostatic hyperplasia. This condition predominantly affects men over the age of 40, and men suffering from this condition have problems like frequent urination, waking up multiple times at night to urinate, poor stream, and a sense of urgency sometimes when wanting to pass urine. Is prostatic artery embolization ideal for every patient with prostate enlargement? No, it's not. So when do we recommend this treatment? As all of you need to be aware, PAE is not the only treatment for an enlarged prostate, and not every patient that comes with the problems that I explained will have an enlarged prostate. So this segment, I want to talk about who is the ideal patient for PAE and when should other treatments be offered. For prostatic artery embolization to be effective, the first and most important aspect is the size of the prostate. The prostate should be at least 45 to 50 grams above. Though there is no upper size limit, anything below 45 to 50 grams will sometimes lead to ineffective treatment response or therapy failure. PAE is not the only treatment available for men with BPH. Therefore, patients with smaller prostates can opt for other alternatives to PAE, like the traditional surgical therapy that is done through the urine pipe called TURP, and newer minimally invasive therapies like RESM, where steam is injected into the prostate through the urine pipe using a device. Another issue that I'd like to address is, does every patient with the urinary symptoms that I explained always have BPH? No, they don't. There are certain symptoms called irritative symptoms which are more related to the urinary bladder and less to the prostate. This can be due to a range of conditions including diabetes, age-related issues, neurological issues, and other causes. So it is important to first determine if the cause of urinary symptoms is because of an enlarged prostate or because of bladder-related symptoms. How is this done? The first thing that we look at is an ultrasound abdomen scan to look at the size of the prostate, and also the post-void residue, or how much urine is left in the bladder after voiding. So this is a simple examination that can determine if the patient has an enlarged prostate or too much of leftover urine in the bladder after voiding. And next, we do something called uroflowmetry. So uroflowmetry is a simple examination again that involves urinating in a small bowl that is connected to an electrical device which measures the speed of the urine. So the speed of the urine reveals a lot about the cause of the urinary symptoms. Often, patients with enlarged prostates and obstruction because of the enlarged prostate can have low speeds. And when there are further doubts after these investigations, your urologist or your consulting physician might suggest something called urodynamics. Urodynamics is an invasive procedure where certain pipes are used to measure the pressure that urinary bladder can generate while voiding urine. So this helps us understand further if there is an issue due to the prostate obstructing the urinary bladder, or whether the urinary symptoms are due to a weakness in the urinary bladder. So once all these tests helps us determine what is the exact cause of the urinary symptoms, and if there is a proven obstruction of the urinary pipe by the prostate, only then do we advise treatment. And to begin with, most of the patients would benefit from a course of medication. Certain safe and very proven, well-established drugs called alpha blockers are used to treat urinary symptoms related to prostatic obstruction. These drugs are extremely effective in many patients, but they do have some side effects like dry ejaculations, wherein the sperm might actually reverse into the bladder, and the patient might end up having a dry ejaculation. And some patients can also have mild dizziness when they get up or sit down, and this is seen in very few small number of patients during the initial course of therapy. When medical therapy proves to be ineffective, a urologist or sometimes an interventional radiologist can recommend further treatment. And these treatments are usually minimally invasive or surgical options. So in surgical options, there is something called TURP, a procedure which involves using the urinary pipe to access the prostate with a cystoscope and then using certain loops to cut the prostate and reduce the obstruction. This is an invasive procedure that requires either spinal anesthesia or general anesthesia, will require blood thinners to be stopped, and comes with the risk of anywhere between 2 to 4% risks of urinary pipe strictures and urine leakage, and sometimes blood transfusions, need to be hospitalized, and having to have a urinary catheter for anywhere between a few days to a week. And there are minimally invasive options that do not involve going through the urine pipe, like prostatic artery embolization. Prostatic artery embolization is a minimally invasive procedure that involves going through a small pinhole access in the groin or the hand and using the blood vessels to access the prostate gland. Once the prostate gland blood supply is accessed, we block the prostatic blood supply using small sand-like particles called embospheres. Once the blood supply to the prostate comes down, the size of the prostate also comes down, and this leads to less obstruction on the urine pipe and relief from the urinary symptoms. The main advantage of PAE is that it does not involve any kind of long-term complications that are related to traditional surgeries when the urine pipe is used for access. PAE has zero incidence of strictures or urine pipe blockages. There is zero incidence of urine leakage after the procedure. Dry ejaculations can be seen for a few weeks after PAE, but most of the patients will go back to a normal ejaculatory state within a month. Erectile dysfunction is not seen in PAE. In fact, about 7% of the patients in some studies have shown an improvement in erectile function after PAE. And this is a day care procedure. PAE does not even require a urinary catheter like other procedures, and the patient can go back home the same day walking, and they generally tend to recover within a week. What can you expect post PAE? Patients can have some sense of urinary urgency and urinary frequency after the procedure. Some of the patients can have burning sensation while urinating for up to 2 weeks. While most of these symptoms can be managed medically, lasting long-term complications are very, very rare with PAE. In comparison to other newer minimally invasive therapies like RESM, wherein a urine pipe is accessed with a device to inject steam into the prostate, a catheter might be placed for patients undergoing RESM for up to a week and sometimes 2 to 3 weeks. And post-RESM, patients can experience significant amount of burning sensation and discomfort in the prostatic area, which is not the case with PAE. And PAE again does not have anything through the urine pipe, unlike other therapies that are available for prostate enlargement. Once you're diagnosed with benign prostatic hyperplasia or BPH and your doctor has concluded that your urinary symptoms are due to an enlarged prostate, there are many options that you can choose for symptom relief. PAE stands out as a well-established, evidence-based, American Urological Association and European Urological Association approved procedure today that is also FDA approved. It has been around for more than 15 years, has good long-term data compared to other newer minimally invasive therapies, and acts on a whole gland level where we are able to cut off supply to the entire prostate, causing shrinkage of the prostate size. PAE is also ideal for men who prioritize their sexual function and ejaculatory function, as it has almost zero incidence of long-term damage to these issues. PAE is also an excellent option for patients who are unfit for surgery or are unwilling to undergo surgery for any reason. And it also is a great procedure for patients who want to avoid stopping blood thinners due to other risk factors. At RIVEA Vascular Institute, we have done one of the highest number of prostatic artery embolization procedures in South India. We use very advanced image guidance using the GE Alia IGS 740 system, which allows us to be very precise with how we treat these patients.